Hi, very good morning. I'm Dr. Janak Patel. Today we are going to see videos on different gaze palsy. So these videos I've collected from YouTube's from many different persons video lectures. So I'm putting them together so that you can understand very nicely. This is mainly for educative purpose. So first I'm showing you what do you mean by conjugated eye movement. So you can just have a look at this particular video. Here you can see this is a normal position.
The ocular muscles in both orbits act in concert to facilitate conjugate eyeball movements. Note the following conjugate actions pairs. Elevation with
This is
adduction,
elevation.
mediated by the superior rectus for one eyeball, paired with elevation and
You can see that both eyeballs are elevated towards. If you consider this as a left side of the person, so it is left upward and outward. So in the left eye, it will be up. When it is upward and outward, it will be inferior oblique, and in a right eye it will be superior rectus.
abduction, mediated by the inferior oblique for the other eyeball. Adduction, mediated by the medial rectus for
And
one
lateral
eyeball,
rectus.
paired with abduction, mediated by the lateral rectus for the other eyeball. Depression with adduction.
This is laterally and downwards. So in this particular eye it will be a superior oblique, and in this eye it will be inferior rectus.
Mediated by the inferior rectus for one eyeball, paired with depression and abduction, mediated by the superior oblique for the other eyeball.
Now we are going to another video channel, that is 1.5 syndrome. This particular will come across, you will come across in a person who develops a damage to medial longitudinal fascicle of one side, which will affect horizontal gaze palsy. And also if there is a damage to, we call PPRF, that is parapontine reticular formation, which supplies or which stimulates 6 cranial nerve. So on the affected side there will be absence of movement of lateral rectus, that is abduction, and also there will be effect on what we call as a medial movement because of damage to medial longitudinal fascicle of opposite eye, and that is called 1.5 syndrome. So we'll be showing you that particular part. So now we are going through that. Here you can see that this particular person is asked to look to the right. Now you can just observe what is happening when person is trying to look to the right. Not able to look. Now she is looking to the left. So you can see that the left eye can abduct, right eye cannot adduct completely. So the right eye, there is a difficulty in adduction, that is because of medial rectus involvement, and that is because of medial longitudinal fascicle being involved. Now you can see a left eye movement. In a left eye, when you ask to look to the right, left eye cannot adduct. and when person is looking to the left, now this is in the right eye, cannot adduct. Now when both eyes are open, convergence is possible, downward gaze is possible, upward gaze is possible. And when person is asked to look to the right, this is while looking to the left, right eye cannot abduct, and that is classical thing which you can see together in case of what we call as 1.5 syndrome. Now this is a combination of 1.5 with facial, we call 8.5 syndrome. Now you can see here, this is a normal position in which the patient is looking straight. You can clearly make out that this particular eye is having a normal position, while this eye is little deviated towards laterally, or we call abducted. Now you can make out much better, much clear. Now eyelids are lifted up. Now when you are asking the person to look to the right, see, left eye can adduct, but right eye cannot abduct. So that side 6 cranial nerve is being involved, or lateral rectus is being involved. This is while moving to the left. So when moving to the left, this lateral rectus is working, medial rectus is working. Now when you are concentrating on the left eye, you concentrate on the left eye, you can see a nystagmus. You can see a nystagmus, right? Okay. Now looking to the left, there is a nystagmus which can be elicited. And now in this right eye, there is no movement laterally. Now convergence is possible. You can see both eye converges. Very clear, right? Now you are asking a person to look to the left. You can see the right eye is also adducting, left eye also abducts, and there is a nystagmus. Now you are asking for vertical gaze. Look up, vertical gaze is possible. Downward gaze, that is also possible, normal. Vertical up, vertical down, both. Now you are asking a person to furrow, lift the eyebrow. You can see very nice furrowing here. Here the furrowing is less, right? Clear? You can clearly observe that there is no furrowing. Now if you ask the person to show the teeth, you can see that right side nasolabial fold, this is not clear. This angle is drooping. You can see a clear nasolabial fold. Now you can see again, this is facial nerve on right side, lower motor neuron plus 6 cranial nerve, that is lateral rectus being involved, plus what we call is a horizontal gaze palsy. When all these are together, we call as 7 plus 1.5. So we call that 8.5 syndrome. Now again, this is showing you another patient with 8.5 syndrome. These I have collected from a YouTube. You can see here, when the person is looking straight, you can see the position of the eyeball. Clear? Okay. So this is looks exactly in the center. This looks little elevated up. Now person is asked to look to the right. This is right side of the patient. So this eye can abduct. This eye is not able to completely adduct. And in that adducting eye, if you look properly, there is a nystagmus. You can see the person can close the eye clearly, right? And if you look on the opposite side, there's a difficulty. Again, I'm repeating that particular. You can see now very clearly. See, can you see adduction nystagmus? And this eye cannot adduct. This is abduction. This eye can abduct. This eye cannot adduct. But you can see the nystagmus here. Now on this side, the eye closure is poor. See, upward gaze is possible. Downward gaze is possible. While moving to the left, you can see this eye is moving completely adducting, but this eye cannot abduct. Means there is a lateral rectus palsy on this side, what we call is the left side. See, this is again you can see nystagmus while looking to the right. See, when smiling, you can see a very good nasolabial fold, while on this side the nasolabial fold is little poor. Is it okay? Clear. Now you are asking to blow. You can see that this side blowing is poor. So there is lower motor neuron facial on left side. So 7 plus 1.5. Again, this is 8.5 syndrome.